So good afternoon, everybody. Hi, I'm Mary Jane Burke. I'm happy to welcome you here to have the opportunity to hear a welcome from Dr. Willis and then to get some additional information from Dr. Santora. Just to remind you, this session is being taped and will be available within about 24 hours for anyone in our community that would like to catch up on the information provided. In addition, it's being simultaneously translated in Spanish. One of my colleagues, Luz Lopez, is here. So for anyone who needs Spanish translation, Luz, if you could go ahead and give them the Spanish message now. Thank you so much.
You're welcome, Mary Jane. Este seminario está siendo grabado. Las versiones en inglés y español estarán disponibles en nuestro sitio web de MCOE dentro de 24 horas. El seminario también se estará transmitiendo simultáneamente en español. Por favor, haga clic en el icono de interpretación de idiomas que parece un globo y haga clic en español. Entonces usted podrá escuchar esta llamada en español.
Great. Thank you, Luz, very, very much. We appreciate it. And so for all to know that we will have information, this will all be available in English and Spanish. So just as a reminder, we have received some questions in advance, but in addition, if you have questions, you can put them in the chat. We'll try to answer as many as possible. These are very exciting times for our schools, and we're very excited to hear from Dr. Willis, our public health officer, about how we're doing in Marin County.
Thank you, Mary Jane. Good afternoon, everyone. Matt Willis, public health officer from Marin. Just wanted to, again, welcome everyone and start by thanking the Marin County Office of Education for the remarkable partnership that has allowed us to have this conversation. This is probably the most important conversation we could be having right now as a community at this time. We are 8 months now into our pandemic response, thinking back to early March when we were one of the first counties to close schools as we were seeing exponential growth in cases across the region. And at that time, there was so much we didn't know about this virus. We've learned a lot since then. Even that second day after we closed schools, Mary Jane was reaching out directly and saying, how are we going to get kids back into schools? We obviously had strong reasons why we thought we needed more time, but we've used that time really well and have learned a lot. The first thing we learned was just a better appreciation in the sense of the harms associated with a pure distance approach. That's something that, as time has evolved, we've recognized, especially for lower income communities and really every student, it's not without harm when we choose to prevent children from coming into the classroom. We've also learned at the same time that there are ways to do it safely. And we've learned a lot about how the virus is transmitted and how it's not transmitted, and have applied those principles to a process that you'll hear more about from Dr. Santora and who many of you have been a part of ongoing to reopen schools as safely as we can with our 30-point school site specific protection plans and other measures. Marin County has been ranked the healthiest county in the state of California for 9 of the past 10 years by the Robert Wood Johnson Foundation. We often get asked, what is it? What is it about Marin? Obviously, the affluence, we're also one of the most affluent counties, and that plays a role. And we know we have a lot of work to do to bring that promise of health to every community. The other element of our success is really the partnerships and our shared values around health and well-being. And our shared values with Marin County Office of Education and Public Health, that we see schools as hubs of not only learning, but of well-being and health for our children. And it's that spirit and that value that we've applied to this process of trying to get children back and our students back into classrooms. So I just want to, with that by introduction, welcome again, thanks Marin County Office of Education. And I'll hand it over to the most excellent partner I could have in this effort, not just in schools, but across the board, as my fellow health officer, Dr. Lisa Santora, who as a mom and as a physician and as an expert in communicable diseases just has all the the brains and the heart that we need to navigate these decisions together. And Lisa has been very deeply involved with many of you as we've worked to reopen schools, and she'll take it from here. Thank you.
Thank you. Thanks, Dr. Willis.
All right, thank you, Dr. Willis, right back at you. So we can jump on to the next slide. And we are making a Masters of Public Health in all of you. This is our Epi Curve, and we are continuing to see that we are on the tail end of our first wave in Marin County. We know that many of you are hearing and seeing the news of increases of cases across the nation and internationally, and we are very much closely following that. But at this time, we are at the tail end of this first wave. You can jump to the next slide. And that is because of the work of all of you. What that means for us now is that we have entered the second week where we have demonstrated the case rates and the percent positivity that allow us to enter tier 3, or the orange tier. We actually are faring much better than just orange in our positivity rate. Our positivity rate now countywide is 1.4%, which is less than 2%, which would now classify our positivity rate as a minimal in Marin County. But we still have cases, and that's really driven by the fact that since the beginning, we have invested a tremendous amount of time and energy in ensuring that Marin County residents have access to testing. So we are case finding, we're looking for COVID everywhere, and encouraging all of our essential workers to get tested on a monthly basis, and making sure we have access to testing, and all of that is keeping the case rate a little higher in that orange tier, but we're really proud of that. It makes us reassured to know that we have an accurate picture of COVID-19 activity in our community. So you can jump ahead. So this is where we are, moderate. You'll see it's orange. We're going to be changing some of the colors that you see. We all need to embrace orange, and that will be the message of today, because us staying in orange really depends on each and every one of you on the call, making informed decisions around your social activity and family activity. And that's what's going to allow us to open all schools in Marin, which has been our goal since March 13th, when they closed, was to get all schools opened up in Marin for in-person instruction. We know schools have been doing a tremendous job providing virtual education, but we really are seeing that the harms of children not being in the classroom, and that's children of all ages, especially the TK through 2, they're not intended. We are not, as humans, not intended to be on Zoom all day. And as adults, we have been forced into a world where we are on our computers all day, but that is not the environment that supports healthy emotional and academic development in our most precious treasures in our county, which are our children. And so you can jump ahead. This is a lot of little words, and it will be posted on our website. And this is where Dr. Willis and I both get a little bit nervous. A lot is opening. And so there's a lot more opportunities when we open the community to have activities and behaviors that COVID-19 loves. And that is when we are spending a lot of time indoors, close together, and not wearing face covering. That is a risk. That being said, we are so proud of Marin County businesses and are thankful to our Marin Recover partners, including our local jurisdictions, cities, and towns, to make sure that all the businesses that are operating in Marin County are operating with site-specific protection plans, much like the school site-specific protection plans. And we still have guidance around this activity. So we encourage everyone to support our local businesses. We know many members of the school community are family members own local small businesses throughout Marin County. And this is an important phase for us in our recovery to open more businesses, but again, to be cautious and as you're moving into that space and supporting our community, but to be thoughtful of how you're engaging in activities. But a lot more is allowed, to check out what you can do while still thinking small. So you can jump ahead to the next slide. So this is a major change. In March, when Dr. Willis issued the first shelter-in-place order along with in the nation, we really did lead the nation along with the other big 6, we call them, counties across the Bay Area. It was a shelter-in-place order. And when you go online, you no longer see a shelter-in-place order. It is now a risk reduction order. And that shifts a lot more responsibility from us as public health officials and your elected officials, from us to you. The risk reduction measures are clear. We have learned a lot around how COVID-19 behaves and how we can stop COVID-19 transmission, but it really shifts the responsibility to the individual residents of Marin County and the groups you gather with and the institutions you visit to work together and to understand the risk and take every precaution to reduce risk as much as possible. But this is still this is absolutely a time to celebrate on one hand, and also a reminder to stay vigilant so we can stay orange. So you can jump ahead. Stay orange, the new theme. It's not our motto yet. We're going to be looking for awesome logos and mottos, and maybe some students will be delivering us with the next message, our theme on how we're going to stay orange. This is my shabby effort. I'm much more of a scientific person than a creative person. The first is to follow our guidance, and it always is changing. That's the constant promise of COVID-19 is change. We will continue to update our guidance. We are closely following the data. As we are reopening, as I mentioned, we're reopening at a time the nation is seeing increase in cases. And so we believe the Bay Area has created a bubble in some ways around itself by practicing best practices from face covering and maximizing physical distancing and opening slow and being really measured and thoughtful. So we do think California is different than other states. That being said, we still live on a flat earth in many ways where there's tremendous travel still happening. People are traveling. 60 to 70% of routes are up in our airs. And so individuals are traveling to areas where there might be higher COVID activity. When you do, and if you have to travel, first really consider if you need to travel. If you do have to travel, really use the same guidance that we have in California to where you go. Don't adopt the local practices, although that might be appealing to take that face cover off and not to be socially distanced and to engage in activities that are prohibited in our state. And in our level, we would really strongly encourage you to bring California with you on how you move through the place that you're visiting. We're strongly, again, encouraging individuals to limit their social activities. Yes, we've opened, but you still should consider limiting those social activities. Most notably, and this has gotten significant attention nationwide, the state of California is prohibiting gatherings of more than 3 households. This is the primary driver of COVID-19 transmission and activity in Marin County and in the Bay Area. It really is now being driven by households coming together. They're burnt out of COVID and they have COVID fatigue and are not heeding this recommendation. It's important to read the recommendation, and if you are going to gather no more than 3 households, you are advised or ordered by the state to stay outdoors. We understand that staying outdoors is not necessarily going to be feasible as we move into the winter months, but at all times, as much as possible, stay outside. COVID-19 does not like it outside. So that is one of our best protections. Open the windows, stay outside. If you do have to move inside due to inclement weather, definitely enhance all the disinfection practices you have, especially around the bathrooms, ensuring that the equipment and materials that anyone would need to clean a bathroom if they're a visitor to your home are available to them so you can keep your house clean. Because this, again, when we see household-based transmission with someone who's known to be COVID positive, it's when they're sharing a bathroom that is a space that we see increased risk for transmission across the household. And so that's why we recommend when someone does test positive for COVID-19 that they isolate at home in their own room and use their own bathroom. So when you do invite guests into your house, you have to recognize that that is a risk location in your house and to maximize every effort. Again, this is not our guidance is not to allow other households into your household, but if necessary, ensure every resource is available to make sure you have enhanced disinfection practices at home. With the updated handbook, so we're in orange, you're going to see an updated handbook for families, and you're going to see an updated decision tree, which you'll get a preview today, which relaxes some of the measures in place. But with those updates, again, comes responsibility. We are increasing the number of cohorts that children are allowed to participate to 3. So your child now can be in school, go to aftercare, and participate in 1 additional activity. So now my kids, when they start school, they'll still be in their aftercare program, but now can shift from Zoom mixed martial arts to in-person martial arts. Martial arts will still have to follow the guidance though from the state. So all laws of the state of California still remain in effect, and that youth activities have to maintain 6 feet distance. It's only for strength and conditioning. This is an area of concern for us in public health because we're hearing a lot of youth clubs are not following, private youth clubs are not following the directives of the state. We are requesting voluntary compliance and reporting of these clubs and activities. This is one of our greatest risks, again, as schools are reopening. We need to be very thoughtful in our activities because we want to keep schools open as long as possible. And can you just jump back to the last slide? I think there was one thing I forgot. There's a new resource on the Centers for Disease Control. I strongly recommend you visit the CDC site. They have great information on traveling and understanding your risk of travel. We know the holidays are upon us. We have to get first through keeping people safe and engage in COVID safe Halloween activities this Saturday. And I think we'll have a slide about that later. But we also know the holidays are upon us too. And to really review the CDC guidance on travel, really consider if you need to travel. And the next step, I think, besides making a decision if you need to travel, think of the other household or family members that you may connect with after you return from travel. If you have vulnerable residents, members of your family, older adults, travel has risk inherent to it, especially long haul flights. And so consider not only if you're leaving, but how you're going to return. And if you are going to travel to other states, to look and see what the COVID activity looks like in those states. We are now seeing states have significantly increased their COVID activity, and you may want to consider not traveling to the state. Of course, if it's necessary for visiting family, if it's necessary, of course, travel there, but really consider is now the right time to travel to that particular state, or should you wait until they're experiencing a downward trend in their COVID-19 cases? Because the reality is with virus, the more it's circulating in the community, regardless of the activity you're participating in, there'll be more COVID transmission.
Lisa, it's Matt, can I just add one point on that? I've been speaking with the other health officers in the region, and this is a shift in the dynamic completely, where we were as a region a hotspot, especially early on, and it wasn't as much of a concern that people might travel to other parts of this nation because the incidence was lower in most other places. Now that's reversed, and we are actually relatively protected, and there's consideration of a potential recommendation or even order to quarantine for people who travel outside of the region, especially if you fly to other states where there's much higher prevalence when you return to the area. So it's just another piece of caution regarding travel, that there may be more strict expectations of quarantine when you return. Thanks.
Thank you. So you can jump ahead. So this is a draft. It's about to be finalized. We anticipate it'll be released on next Monday by the time we get it translated into Spanish, and cross our T's and dot our I's and correct any typos. But this reflects what we're seeing just based on science and what we're learning more about COVID-19 activity, and also reflects that we know that COVID-19 is not going to be the most common disease circulating among Marin County residents. And so you're going to see a relaxation, one, in what are the symptoms that require testing for COVID-19 or healthcare evaluation, and shifts in the requirement of currently any symptom basically requires a healthcare evaluation. Now, if there's only one symptom, parents will be able to keep a child home, make sure this child is improving and they're fever-free for 24 hours and return to school. So on the left side, you'll see the columns of the symptoms. We now know there's 3 key symptoms for COVID-19. It's coughing, shortness of breath or difficulty breathing, and the loss of smell or taste. And so if you have any of those key symptoms, you're going to have to get a test for COVID-19 or see a healthcare provider before you return to school. If you don't see a healthcare provider or get tested, it's that test or 10 practice where you're going to have to be treated as if you have COVID-19 and stay at home for 10 days. When you have those key symptoms, we're going to be treating the siblings and household contacts as possibly exposed. And so they will need to go home if they're at school or stay home themselves until we have an evaluation of the student who may be the sick student with those symptoms. And then we list, and the next list is directly from the Centers for Disease Control. If you have, in the new definition that we call it a case definition for COVID-19, if you have 2 or more of the symptoms listed, you also need to get tested for COVID-19 or see a healthcare provider for an evaluation, or will be treated as if you're infected with COVID-19 and need to stay at home for 10 days. And so again, if you have the key symptoms that I listed, and you'll have a copy of this, so you'll be able to review it, or 2 or more symptoms, so a sore throat and a fever, you'll need to have a healthcare evaluation. If your child, though, and this is where we're going to be shifting a tremendous amount of responsibilities back to the families. If a child just has a sore throat, they can stay at home until they'll be sent home with a sore throat. But if their symptoms are improving, you can send them back to school. Or same thing with a runny nose. So this is a big change. So if your child just has a runny nose, they'll be sent home. Probably you should keep them home until their symptoms improve. And then they can return to school as long as they're fever-free for more than 24 hours. If the child just has one symptom, their siblings do not need to stay at home. The key for this, and what we're hearing a lot, is it's your gut instinct, because it's really around what risks have your families engaged in that might have placed your child at risk for exposure to COVID-19. Again, the primary way people in Marin County are getting COVID-19 are when they're indoors gathering with 3 or more households. That's what we're seeing now. It's a different pattern of transmission than we were seeing previously. So that means, again, there's a lot of opportunity for us to prevent COVID-19 transmission. But if you have a child with a runny nose and the weekend before you hung out with a couple of families, even though we recommended that you didn't, then I would recommend you get tested for COVID-19 because you've engaged in a riskier behavior. So I'm not going to go through all of it today. We are really thankful. We're going to be having our next meeting today is with our public health liaisons. Each school has staff that will help you make your decisions. Some of your schools will be providing tools around screening to make sure you also understand the screening requirements for allowing your child to go into school. But this is a relaxation, but we really now are depending on you as parents to understand the symptoms, understand the risk, and trying to minimize any potential exposure to COVID-19 and follow our decision tree. So we can jump ahead. This is a new tool we're really excited about. It is our school status dashboard. And this is where you'll see, you can go to our website and see it. All the schools that have opened, schools will have had to open for in-person instruction more than 10% of the class to be turned from gray to green. So we know schools are open, but the grays are for virtual learning and the greens reflect that there's in-person instruction. And so we are going to be providing you information with students and staff who have tested positive for COVID-19, who may have had exposed the school community to COVID-19 and that we're actively investigating. That would exclude, though, if a student over the holidays gets COVID-19 and wasn't on the school campus, that student would not be counted. So we're really only going to be counting students and staff who were on campus and may have had an exposure, may have caused an exposure to COVID-19 on the school campus. And then we're also going to report anytime we identify a case of suspected school-based transmission. That's when a person who might have been in the same classroom as a COVID positive person tests themselves test positive for COVID-19. Again, it's really important to remember that we have so many protective mechanisms and preventive measures in place that even Superintendent Hogaboom has said this many times, it's almost like universal precautions. Our school site specific protection plans are designed to think of everyone as having COVID-19. And so we're implementing the measures, very strong measures to ensure that we don't see school-based transmission. We know COVID-19 is going to enter the school campus. We are doing our best to make sure it does not result in any transmission on the campus by doing all the things in that handbook, by making sure you screen your students before they go to school, you engage in very low risk activities while your students are in school. and that we are having maximizing physical distancing. We are having stable cohorts. We are wearing face covers, which many parts of the country and world haven't been wearing face coverings. I just saw the France just implemented a face covering in schools. So we're doing everything we can to ensure a safe practice and to treat as if COVID-19 is there, even though right now the likelihood of COVID-19 circulating is significantly lower because of the rates that we're seeing. So you can jump ahead. And it is Halloween, and I know my kids dressed up for school today. I know so many kids are so excited, and at the same time might be sad that it's not going to be Halloween the same way. We have guidelines for how you can enjoy safer Halloween by having Zoom calls and costume contests in a virtual fashion. What I'm doing with my family, we are going to have pizza. It's going to be, it won't be Friday, but Friday's normally pizza night. We're going to have pizza. We're going to walk around the neighborhood just with our household and one other household outdoors and rate the houses. And I'll have some treats in my pocket to supplement what not allowing them to go door to door, but you can have safe ways. We also have an amazing Spook Fest that's happening on Saturday at our Marin Center. And I think actually every night this week, you can drive through and see Spook Fest at the Marin Center and get some non-public health approved treats. But I think right now it's a good exception, as long as everyone brushes their teeth, to go get some candied apples at the Spook Fest at the Marin Center. So you can do it safely. Again, stay outdoors, no more than 3 households, no door-to-door trick-or-treating, go rate the spookiest or funniest house, engage your kids. They are looking forward to this. If you are a parent that normally doesn't dress up, but we can do this safely. You can jump ahead. Bibliography. At our last meeting, I promised a bibliography. You brought out the nerd in me. So we will be distributing this and posting this. We've done it by topics and in order of some of the research that we've been looking to guide our policies and decision making. And the newest one, and it's only new because it's not the most important thing, but it's only now we're starting to see research published around child well-being as it relates to school closures. So that's the most updated section, as well as travel. So the 2 updated sections from last week, we finished it last week. I got excited right after the meeting because I'm a nerd, and did it last week, but the new updates are on travel and social and emotional well-being for children. So we'll be sharing this with everyone as well, and it will be posted to our website. And we expect to update it every week or every 2 weeks, but we'll try and stay committed to that. And flu shot. I'm sure everyone has not gotten their flu shot on the call. There's no excuse now. Now's the time to get your flu shot. This is how we're going to protect our healthcare system, is by making sure everyone is vaccinated, and it is effective, it is safe. So go get your flu shot. All right, I think that I'm done with my part.
Okay, great. Lisa, thank you. Thank you very much. There's a question from a parent, I believe, who is trying to understand the challenges for the public school people in keeping up on the data, like how are they going to be sure that they can have accurate information in our school districts? And one of the questions that came up had to do with a district trying to ensure kids come back using the 6-foot strategy as opposed to, for example, the 4 to 6 foot strategy. And I would like to take my first shot, and then Lisa, you could add to it. I think one of the things is the information has been evolving, and it continues to evolve. And as hard as our school districts try to stay up on the data, and as much as we are moving information from public health to our school districts, it does continue to evolve. As you saw today, we had new information that was provided. And so we'll try to make sure everyone has it, but it's not necessarily happening as quick as some might get the information. That's one. But number 2, that each community is making the decisions that best fit their community on how it is to get students and staff back into school feeling safely. And so information is identified on a school by school basis in their school site specific protection plan. Those are online. You can go to the plan and read it. And so schools are following those plans, and those plans, for example, might actually identify the distancing they intend to use as they come into school for their first phase. So I would say that. Lisa, what would you add to that?
I would say that we're navigating a lot of fear, worry, and anxiety, and there have been compromises that have been made because of those real feelings that people are having. And we have provided our guidance, but schools, districts at the district level and at the school level can have more strict measures than what public health is recommending. And that is, and we respect that. Again, for us, we are strongly committed to finding the place where we can agree on how to bring the kids back to school. That's our top priority. And if there needs to be modifications from our guidance, and what we're seeing more often, it's more strict than what we're recommending. What we understand is that's what some people need to feel safer in the school environment. So we respect that. Getting kids back in the classroom is our top priority. And as we believe, once people are back in the school environment and see how structured and safe it is, I think getting back on campus is going to help a lot, because you'll see it can be a much more structured, safer environment. Our partners at the school levels have done a tremendous job really being thoughtful around the movement through the campus. And I think once parents, teachers, and staff can see how children can adapt, they are resilient. This is going to be our strongest, most resilient generation. I think it's our next greatest generation. They want to be back in school. They are going to do everything they can to be back in school and follow the rules. And I think once staff, parents, and teachers see that, and see that we've created a safer environment, and we already see it. It's been since September 8th, school's in session. We still haven't had a suspected case of school-based transmission. We are expecting it will happen. We're not a perfect system. This is not a zero risk environment. But I think once people are back in school, their confidence will build, and that we might see adjustments at the school level.
Dr. Santora, do you have any information about how after school programs are coming back? Are they following the cohort rules, etc.?
So it depends. It depends on who is operating the after school program. There are some programs, my kids included, that are licensed childcare providers. And those licensed childcare providers have to follow requirements from the state. They're licensed by California Department of Social Services. And at this time, the state is they're capping the size of the aftercare program to 16. That's 14 kids and 2 staff. There's some flexibility on staffing just for coverage purposes. But if it's an after school program that's not a licensed childcare provider, we would recommend they follow our guidance and still our 30-point safety plan. So it really depends on who is the provider of the after school program. And the single key factor on how it is run is whether they're licensed by the state of California. Mm-hmm. And we've inquired, we haven't heard yet the state is budging on its licensing requirement at that 16-person cap.
Mm-hmm. Lisa, what's the maximum amount of students a private school can have per classroom? And I just want to note that for anyone on the call, private, public, independent, parochial, all have the same guidelines.
All schools are allowed to have the regular size class as before. With our recommendation that we are currently recommending no less than 4 feet between students. And so that's the current recommendation, but allows them, there's no cap on only 14 kids or only 16 kids in the classroom. So schools can operate a regular size classroom as long as it's following the 30-point guidance.
Okay. Is there a limit for 0 to 5 age students related to the 3 cohorts?
No, it would just be 3 cohorts for
any child.
For any child. And again, the reason behind the 3 recommendation, especially if there's multiple kids in the households, anytime you're engaged in a cohort, it's a risk behavior. It's less risky if the cohort is outside and always 6 feet apart. I watch my kids when I pick them up every day. Kids are like magnets. It is not from 5-year-olds, 10-year-olds, 14, 17-year-olds. Their nature and our human nature is to connect. And so the more cohorts you have, the higher risk of possible exposure to COVID-19. Especially, again, we're going into this travel season where your child's friend in one cohort, you may not know that their parent traveled out of country or traveled to a high risk area. We, again, are depending on everyone following our guidance, but you need to be aware that you may not know the risk activities that child, another child in your cohort may have been exposed to.
Have there been any changes in the maximum number of students for a child care cohort? What is that number?
If it's a licensed child care provider in the state of California, then the maximum right now is 14 children.
Okay, great.
And that's no longer county. There was some confusion around this because the county led, the Bay Area counties led the state for a long time. And so we developed our own guidance because we didn't receive guidance. And there was original confusion because we selected the number 15, and this was in, as we're going from May into June. And then the state landed on 14. But now that the state guidance is in effect, we have to defer to the state. So you're no longer under county restrictions, it's the restrictions of the state.
Mm-hmm. There's some questions that are coming up. And in fact, Lisa, I think we're going to ask you to potentially meet with athletic directors and our team that works on sports. But at this point, high school sports. There's some thinking that December 7th, high school sports starts. I heard you yesterday talk about what is allowed related to high school sports. So we'll get a more intense conversation, I think, with athletic directors, but could you answer that generally?
Yes. So we've been also connected with the athletic trainers, with Kit Holston who also works at Marin Health, and they're developing guidance for athletics that we are currently reviewing. She's just updated it to reflect the changes that we've implemented with our handbook. And so we absolutely will meet with them. At this point, again, we're following the restrictions of the state. It's only strength and conditioning. This is another area of concern for us. My email is a very interesting place to see, and my phone is too. We're getting a lot of reports of private clubs, private youth sports clubs that are not following our guidance and not following state law at this point. And that threatens all of us, especially as sports move indoors. It was easy for people to report when it was out on the soccer field and kids were playing soccer and to provide our input. It gets harder, for example, a basketball club that is not following the state guidance. The state guidance it's strength and conditioning only. It's 6 feet apart. You need to follow, if it's a gym, right now a gym can only be open at 25% capacity. So you have to look at that capacity when you're using facilities. And this is an area that I'm concerned about because I'm hearing other people communicate to me specific places where they're not following state law. So, and that, again, that threatens our schools staying open. And
right.
And that's why we have to stick together on this.
So there's another question here that I'll just say, expressing great frustration over the fact that it's been a period of time since we offered the 30-point plan that identified ways for schools to come back safely for both the staff and the adults. And the frustration that's being identified is, isn't there a moment in time, Dr. Santora, that in fact someone will mandate the children coming back to school? I think we can both probably comment on this one.
I cannot mandate students return to school. This is an individual school district decision. We have seen other states and other governors issue directives and mandates. That is not the case in the state of California. And again, I think for all of us, we really depend on our partnership, and we depend on collaborating and meeting people in the middle, finding the middle for all of us. And I appreciate the frustration. And again, I think that's why we've been, I'm here as much as possible with the schools to help them see that we can do this together. This can be done safely, but public health cannot mandate. We do see it causing harm, but it doesn't hit the level of a public health threat where we can issue health orders to mandate the opening of schools. That is something higher than Dr. Willis and I can do, or Mary Jane Burke.
Mhm. I would want to add, though, that this is a frustration at the governor's level right now. And so as I've been in contact with colleagues, trying to figure out like what are the steps that are necessary. In spite of the frustration, I would want you to know that Marin County is actually ahead of the rest of the state in terms of schools moving to opening for at least some in-person activities for children. I believe by mid-November, all of our TK elementaries will have some in-person opportunities. And as you're aware, some students are attending, 5 days a week in the smaller cohorts. So that's perhaps not much solace, but I talk to colleagues all the time who are calling and saying, how did you do it? What have you done? What were the steps? And the steps were to, as you all know, try to develop a plan, a 30-point plan that was available on June 18th and revised on, I think, August 3rd. That plan is not something that you see in other places in the state. And then you ask the schools to develop a task force at their school with all the stakeholders involved to look at their own site-specific plan. And then you provide trainings and videos and conversations like this to continue to raise the issues. And then you have a pilot program, so you begin to have people deal with some of these anxiety issues. Because if you're someone who has been sheltering in place for the last 8 months, you are very anxious. And the thought of going to the grocery store, let alone into school, obviously is a challenge. And so our responsibility then is, how do you help people get to school, get into the classrooms, and get a sense of all the protections that are in place? I do think that we are seeing it's 100 times better than it was, right? Just 1 month ago, as we see schools coming back in. But just as a reminder, we can't open school without children, without our school staff, without parents feeling safe, and it doesn't seem to be evolving in the same ways with all of our communities. But I will say this, that we're moving forward. People are working, really, really hard. And I do understand the frustration, but I am so proud of what is happening in our community. And we should all give ourselves a pat on the back and continue to lean in, because we know that the best place for kids and staff is to be safely in school. We, as Lisa described, we have over, I think, 130,000 days of in school of children without any transmission, student to student, student to staff, staff to student, or staff to staff. So we are, at this point, we're showing that our protocols are working, and those protocols, as you know, are pretty basic, but they are working. Lisa, someone wants to volunteer their help for your tagline. Thank you, Rick Byrne. That's very kind of you. Sorry, Dr. Willis referenced a possible restriction on the horizon, being able to travel out of state. Is that correct? Also, when are we expecting to see the guidelines on youth sports?
I can address the question regarding the travel. Can you hear me?
Yes, yes.
Yeah. So it's a conversation that's happening among the 6 health officers of the core Bay Area counties to really, especially as we come into the holidays and recognizing that people are going to be traveling, combined with the risks of coming indoors as the weather gets colder, as we try and return children to the classroom. There's a lot of factors coming together. And the last thing we need is people traveling outside to higher prevalence areas and bringing the virus back. And so one of the key strategies that's been implemented globally is quarantine. So you either shut the borders, or you say if you've been outside the area and you come back, you need to isolate for a period of quarantine for 14 days. If you don't develop symptoms, then you're okay and you come back. Or come back for a period of time, get tested. If the test is negative, then you can return to either school or your workplace. We have not finalized that guidance. It's likely to be a recommendation rather than an order. But I offer that just by way of to show that that's how seriously we're taking this. And especially that's a trend that's emerged just over the past 3 to 4 weeks, as we've seen dramatic increases in cases in other parts of the United States, while we've seen corresponding progress locally.
Mm-hmm. What about athletics? Has public health considered a mask mandate for kids in sports, even outdoors? I have my child wear a mask, but most of his teammates don't, and it seems like they don't have to wear masks in school. Huh.
They should be wearing masks in school. If activity is outdoors and they can maintain greater than 6 feet distance, then they do not need to wear a face covering. We have seen some schools opt, though, for physical education to require face covering, which is allowed to. It really is based on the culture of the school. But outdoor is very protective as long as the students are engaging in activity greater than 6 feet. And just we're hoping the athletic guidance comes out next week, but if nothing's going to change with our guidance, they'll provide a handbook on symptom screening, et cetera. We're considering a potential quarantine option because we know some students are in competitive sports that travel outside of the state of California, almost in sync with what Dr. Willis was saying before about travel outside of the state and what is being considered. That's not been finalized yet, but we're operating under the laws of the state of California, which our guidance can't change. So until the state allows school-based competition, the County of Marin's not going to allow that.
Okay, I think we've gotten to all the questions, Lisa, believe it or not. Maybe I would just want to say to close to everyone, I know these are challenging times. None of us have been through a pandemic before. For most of us, and for most of you, you've been dealing this 24/7 for the last 8 months. It is a time when, for many of us, we're actually like, right? It feels heavy, right? As we try to think about our own families, ourselves, and then as we, try to ensure that we do everything we can to support our children, each and every one of them, the most vulnerable kids with special education needs that don't have a safe place to actually do their Zoom classes, and also, students who seem to be doing okay with online instruction, but are missing that connectivity that is oh so important. Now, as we know, school is about academic learning for sure, but as we well know, it's all of those other pieces that help all of us be fully human and have our children have an opportunity to interact with adults who aren't their family, who also care deeply about them and can guide them into the future. So I would ask that as we move forward in these next weeks, that we do it with all the kindness and compassion we can on behalf of a common goal. The common goal is that Marin County stays in the orange, not only stays in the orange, but moves to the yellow, so that we can continue to have more access to the things we love in our community and the people we care so deeply about, number one. But also, as we do everything we can to ensure that our very future, right, the students, that we are able to get them back into environments where they'll be able to access their education more fully. But just remember, it will take all of us every single day to be able to make that happen. And don't underestimate mental health issues, particularly those of anxiety, for people who are truly so fearful about their own health, but more often than not, their fear is about the health of others they might be coming in contact with. So I think let's be kind, compassionate, do everything we can, and know that we're leading with our students first. We do want them back in school safely, and it's going to take still some time, but we're moving absolutely in the right direction. So with that, thank you. Thanks, Lisa. All right, talk to you all later. Look forward to the next opportunity to be together. Bye-bye.